So thank you everyone for joining us for the CCPO-ICAR seminar series. And we have with us today Dr. Cassandra Davis, who is an assistant professor in the Department of Public Policy at the University of North Carolina at Chapel Hill. She has a PhD and MA from the School of Education at UNC Chapel Hill and a BA from Wake Forest University. She is a fellow with the Center for Resilient Communities and the Environment, the Institute for the Environment, and with the Carolina Population Center. Her research focuses on social justice and emergency management, a topic that is very near and dear to my heart, and assessing the extent of hazards and how they widen inequalities and disaster recovery. So, Cassandra, thank you for joining us.
All right. Thank you so much for the great introduction. Thank you everyone who is joining us on a Monday afternoon. I really look forward to more of the informal conversation. So I will not zip through the slides, but I'll go through the slides, but I'm absolutely open to having this conversation. It's about community building. I know probably as we was talking about my background, I have a smorgasbord of different disciplines. I have education, I have sociology, I have history, all of these very different spaces. And I ended up in this area. I'll just say very quickly, I started out looking at inequality at the schooling level. And it was after Hurricane Matthew that hit North Carolina in 2016, where I noticed significant differences in responses and support and efforts, especially as we're looking to low income and communities of color. And I didn't understand what was going on. I met with a ton of people, and from FEMA to our governor's office to state and federal representatives, and no one had an answer. They just said it's just what happens, and we don't have a solution. And to me, that wasn't enough. So I kind of slightly changed directions, but still with my roots in sociology, still with my roots in history, still with my roots in education. I really wanted to understand and assess and better inform policy on how we are can improve and reduce these inequalities. Stay on that. Okay. This was already mentioned earlier, kind of my research buckets: social justice and emergency management, hazards, the extent that hazards widen inequality, and then disaster recovery, specifically for socially and historically marginalized schooling communities. These are kind of two buckets that I'm in. If we look to the left, my focus on different types of methodologies that I feel very comfortable with. Qualitative work, so that's interviews, that's focus groups. That's a number of different things of collecting words and content analysis. Multi-sided ethnography, I enjoy going and staying in places for a long period of time to understand how these different things are impacting different types of groups. I'm also versed in administering surveys. I'm wrapping up a project right now where we looked at photo voice, where we were tracking first generation college students and how they were taking pictures or documenting the COVID-19 experience and from their lenses. And then mixed methods. I work with, as fun as my my background is, I work with a ton of people from a variety of backgrounds, from planning to statisticians to water people. I mean, I work with everybody and anybody who's interested in disrupting normative behavior that is oppression. The theories that I'm also very comfortable with working with, that I've studied extensively in, is critical race theory, participatory action research, intersectionality, and grounded theory. So before I really jump in, I really want to just stop and thank the larger community of voices for helping kind of the team and I to put this project together. We sought out to get, understanding how communities and how local governments and the academics are talking about ways to bridge, create a bridge between all the groups. And how do we address and build trust, especially as we're thinking about improving recovery responses with hazards. So these groups represent personnel from NGOs, faith-based organizations, local government officials, state government officials, and academics, as well as communities impacted by hazards. Also wish to thank personnel from DHS, FEMA, NOAA, CRC, NIST, The study was also funded through DHS by way of CRC, based at the UNC. So very quickly, this was the team that I worked with, helped lead last year for this project. We are a ragtag team, I believe, there were 4 faculty members, a couple grad students, and a number of undergrad students on this team. So really quickly, again, this project that I'm speaking about, we're currently in year 3 of the project. And the presentation today that I'm going to show are going to be the results from year 2. In the first year, we were asked to conduct a literature review. We were asked essentially, hey, we're seeing that some groups are being hit by hazards more than other groups. These groups tend to be people of color. As well, we're also seeing that federal aid disproportionately impacts marginalized communities. What is going on? And I was excited for the opportunity to dive into the research, the literature, and help explain what was happening. And so we looked at these 3 type of areas. We wanted to identify disaster resilience needs of different types of groups. We wanted to identify the different agencies that were engaging disadvantaged groups. And then we also wanted to reveal the barriers to federal investment that was specifically under BRIC, which is a program under FEMA. From our year 1, we created policy recommendations for our next steps. And we decided, if we were able to get an opportunity for year 2, we wanted to really look at PAR, the participatory action research, to understand how does one improve communication between agencies and community. Also, what's the culturally competent interventions? What do they look like? And then last but certainly not least, dismantling systemic racism, since that was a major finding in our results. Well, we received funding. And so for our year 2, the methods that we used, we continued on with PAR as our conceptual framework. We facilitated discussions with 3 advisory groups. 1 group represented community members, the next were government officials, and the third were academics. We then administered a nationwide survey that was a pilot, and then we hosted a virtual workshop for participants and stakeholders. Very quickly, for those of you who may or may not know, PAR is a practice that allows researchers as well as community members to work together, that they see them both as equal experts. They're held in equal esteem through the research cycle. It's really about involving real people and their problems, and the focus of it is really on their strengths rather than the deficits. So we wanted to make sure that as we're talking about community building or engagement or building trust, that we were coming from the perspective of not just the researchers, who we can very well be as outsiders, but we wanted to come from the perspective of actually those that were within the communities. So these are findings. From our advisory group, as I mentioned, we facilitated discussions with advisory group members. We had a total of 25 participants. We had 10 members that were in the community focus group, 8 in the government focus group, and 7 that was in the academics group. These individuals, they represented all 10 FEMA regions. We had 19 states, including the District of Columbia. And so this is just kind of a map of where our different advisory group members came from. We had a total of 9 focus groups. They lasted about a little over an hour to about 2 hours. We audio taped them, we video recorded them. We transcribed the interviews, and then we also wrote general notes after each session. And so these focus groups were administered between January and March of last year. The other thing that we did is that we made sure that each session we had the exact same topic and the same questions were given to each group, and we wanted to hear the extent that we found similarities and differences. So in our first session, the topic of establishing a baseline, this is how it was kind of broken up between the different groups. where on the left you see community, in the middle you see the government officials, and then on the right, far right, you see the academics. And so in talking about understanding a baseline of like, how did we get here? Community members were very clear in how who they identified as those that were being harmed. They also talked about the contributing factors that include contributing factors to inequalities around hazards included access to broadband, access to food, housing, health, and history. In addition to that, the government talked about not having enough time and resources to anticipate or meet the needs of their community. They also said that they would like to be more culturally responsive, but were really unsure of how to start. They heard the buzzword equity, but really didn't know what it meant. In addition to that, academics talked about how framing can hinder or help groups. They also said that marginalized groups have a lack of sovereignty due to social and structural inequalities. So in this slide, I have 3 different quotes from the groups. I'll be quiet to just give you a chance to read one or all of them. Okay. So some similarities and differences that we found, that everyone or every group mentioned that marginalized groups were left out of the conversation. We found that community members and academics talked about how governmental agencies should improve their cultural responsiveness. We found that the government officials said that the agencies are interested in improving their understanding of equity, but just needed the resources. And then we also found a connection between how community members and academics talked about information being lost through language and how disasters amplify systemic inequalities. Session 2, we looked at trust and building relationships. And again, these are the different ways that these different groups spoke about these topics. Instead of kind of reading each one, I'll just kind of pull out some quick things. For the community, they talked about NGOs are quicker to support marginalized groups. In the government, they talked about getting to know the informal and formal leaders within community. Specifically, they mentioned instances where you would go into the community, instead of going straight to the mayor, you may go to the owner of the dry cleaning business, that was the actual leader. And the academics talked about how trust is a slow moving process, which actually this is what we was talking about earlier, which conflicts with funding, opportunities, and research timelines. You get a call that says, hey, you have a research study and you need a community member to sign on board in 2 weeks. Well, building trust kind of conflicts with that immediacy and timelines that we see. So these, again, are 3 quotes. I'll give you a chance to look at them. Okay. Some of our similarities and differences, we saw a lot of similarities. The one thing that was really interesting, besides that everyone agreed that building trust takes time and it's absolutely vital. Everyone talked about the invisible leaders. So those are visible within the community, but they're invisible to outsiders. And then a really interesting thing was communities and governments rely on NGOs. And how this was interesting is that everyone agreed about this, but for different reasons. For example, the community leaders were saying, hey, we are the communities that are impacted rely on us, rely on the NGOs to provide support. The local government officials were saying, hey, of course, it makes sense that communities should rely on the NGOs because they're situated there first. We don't have the capacity or the ability to meet all these needs, so we depend on these organizations that are instilled within the community. Although they agreed on this, they agreed on them for very different reasons, which from our perspective kind of creates a bit of mistrust. And lastly, we wanted to ask our participants some of their policy recommendations for moving forward. And these are some of the differences that we saw. For the community, they said simplify the process and be responsive. And the process they're talking about is kind of applying for aid and support. the government talked about careful about redefining the role of emergency managers and implementing policies. That this is a tricky, we can all agree that we need to understand equity a bit more, but there needs to be a conversation about what does the role of EM actually mean. And then the academics talked about how the current systems can't handle the existing problems. Again, around this concept of rethinking existing roles or existing policies may have worked before climate change, but now that we're seeing kind of an increase in these hazards with intensity and frequency, that something might need to be changed. And so here are again some quotes. All right, some similarities and differences: being inclusive, um, and improving communication so that it's transparent and simplified. Again, is something that I said earlier, rethinking the roles of policies and emergency management personnel. Now it's expected, unfortunately, it's expected that we will be faced with some bit of hazard that will be impacting groups of people on a very large scale. And so it's could be at a point in time where we'll have to rethink individuals' roles to really kind of address potential burnout, that this isn't going away. So summary of findings for the advisory groups: we found that there was a consistent understanding of marginalized groups and how events impact them. We found that community and academic group members reference histories and communal support and treating all individuals as humans. We also found that government group members, they would like the tools to be culturally responsive and equity-minded, but they often cited a lack of resources to meet their basic needs. They cited, equity is this word that we keep hearing, and of course we want to be equitable. We have no idea what that means or even how to apply it. And then lastly, needing clarity around the evolving roles of NGOs and government agencies. Really seeing that disconnect if one group is saying, if both groups are saying, yes, the NGOs are responsible, but are saying them for different reasons, just an idea of some bit of clarification can help out. So our online survey. The research process for this, we reviewed over 50 articles that were related to PAR and surveying community members. We item matched topics to the literature to create relevant survey questions. We pulled topics discussed specifically from the advisory board meeting so that they would influence the makeup of the actual survey. We asked that advisory members review the survey and provide edits and feedback. And then we uploaded the survey to a web-based platform, Qualtrics. This is an image of a database that we constructed where we went through and we identified, I'm going to get my numbers all confused. It was over 140 nonprofit organizations, NGOs, that were located nationwide that specifically supported marginalized populations throughout an event. And so we wanted to identify where these places were and what they did. And so this is just like a quick image of that database. You see the map, the dots represent each organization for which we administered the survey to. They represented all 10 FEMA regions, 46 states, 5 territories, and commonwealths. We were able to administer to 179 organizations. And we found that roughly half of them were located in regions 4 and 7. So who responded? We had a total of 81 responses. We see that a majority of the responses came from private nonprofits. We asked, at what level does your organization work? We see that most talked about working at state level. The next we see neighborhood and community, county and city. And we also had a few that represent a tribe. So which of the following describes your organization's key target populations or groups? The top response was low-income persons and households. The next one were elderly, and then people experiencing homelessness. We asked them again if they were aware of FEMA's Building Resilient Infrastructure in Communities. That's a BRIC grant program that provides mitigation funding for organizations, specifically organizations at the local level, the state and local level. We found that a majority of them said no, they were not aware of this program. And then we asked if the organization, of those that were aware, did they ever apply? And we found that only 2 actually applied for BRIC support. We then asked, what solutions have you found to be successful in addressing the impacts of natural disasters on marginalized communities? And respondents said emergency funds. They talked about food and water, assistance with paperwork and supplies. Here's a quote that we have from this question: how are you able to address inequities for marginalized populations before, during, and after an event? And I'll let you read that. Here are some other additional resources, or information or understanding needed to build trust between members and the organization. And people talked about funding, training, more funding, follow through and follow up, and further internal racial equity work. Some additional questions, please rate how satisfied you are with your organization on a 1 to 10 scale. Please rate how satisfied you are with your organization's ability to communicate effectively with marginalized populations in the community. And then what would be the top items you would purchase to support marginalized populations recover from a disaster? The number 1 was human resources. People said that they were ill-equipped. They didn't have enough man, woman, human power within their offices, their staff, to support such responses. They also talked about administrative cost. So the purchasing went more toward ensuring that they had the infrastructure to actually support groups. And we found this to be very similar when we asked those that represented local government. So summary of our findings, we found that, our respondents represented all FEMA regions, that approximately 41 were aware of the BRIC program, but only 2 applied for support. And respondents cited funding, communication, and diversity as a tool to help assist with building trust. And then also they needed more human resources to support marginalized groups better. So last but not least, we administered a virtual workshop. This was part of our PAR process. We wanted to ensure that the data that we collected went right back to the community. So we hosted it the first week of May. It was about an hour and a half. And in that, we invited everyone who received the survey, all of our advisory group members, as well as any interested stakeholders who just wanted to be part of the conversation. At the end of the presentation that we shared, we asked them some questions and we put it in the form of a Jamboard. And for those of you who are not familiar with a Jamboard, it allows individuals to kind of put sticky notes, to put their ideas on a space, and then we can it enables the facilitator to discuss the different responses. These are just a snapshot of some of the items that were present during our Jamboard session. So just really quickly, what surprised you? Some people say like nothing really. Surprised that a low awareness of FEMA programs. That was something that surprised individuals. What resonates with you? Rethinking the roles of policies and emergency management personnel. Needing more funding for government to fill even basic blue sky roles. We asked them, how do you know when you're heard and you're valued? Follow-up questions, contact, seeing results or progress when actual changes are being implemented. And what are some critical next steps to ensure that you or the communities you serve are heard and valued? Policy changes, funding allocations, listen without trying to fix. These are just, again, some of the responses that individuals provided. And some of our summaries, really a low awareness of FEMA resources that are open to the public. Rethinking the roles of NGOs and government leaders in policy, again, something that came up within the workshop. Need to see the action and feeling heard, and next step should absolutely include the stakeholders. So in all of my projects that I lead, we have this component where we ensure that we're distributing our findings, especially if we are working directly with communities. Um, there is an unfortunate there's an unfortunate perception, which can be true, that especially academics can be very violent and harmful, that we will take research and run, and we will leave the communities behind, which then hinder our own relationship building with these spaces. So what we did, again, this is that map where I showed you each of the NGOs that received a link to the survey, not to the ones that completed the survey, but to the ones that received the survey link. We then, at the end, I believe, when did we send that out? We sent out the policy brief, I want to say this past fall. So on the left is the policy brief. It was a snapshot of our findings. It was as a 2-pager front and back, where we provided kind of information. I think it was a 3-pager front and back. And within the policy brief, you saw images, very colorful. Like this page is the top page with the most text, but a lot of data visualization on items and responses and kind of next steps. Now, for those that just wanted to get their hands into more data, we also provided a full report that also went out to everyone. And so from there, for about, I want to say for 6 months, we were invited to present at the FEMA NAC, which is an organization that helps to ensure that FEMA is doing equitable acts. They provide recommendations to the White House. We were also asked by NIST. We were invited to the Making Waves in Equitable Coastal Resilience through ODU, and then also invited to the Southern Political Science Association. So our next steps. As I said, we are currently in year 3. We continue to use PAR as our foundation. We had our survey validated. That took about 5 months to do. We then also, we took our list from about 140 NGOs, and we increased it to over 5,000 NGOs. And we also included a sample of non-government officials nationwide. We administer the survey, and then we plan to host an online workshop again in early May. We want to continue the work, sharing reports and presentations, journal writing, submitting to journals, continue the conversation with agencies on how to address marginalized communities' needs, and assist with building a vital bridge between community members, federal agencies, where both are deemed experts. So that's all I have. I hope that was enough time that leaves us time to have a great conversation.
Thank you, Cassandra, for the presentation. I'd love to open it up for questions. Feel free to unmute yourself, or we can also entertain questions via chat. If I'll open it up for anyone from the audience first. Gail?
Hi, Cassandra. I have a question about marginalized groups. Did you have a standardized definition that you used for marginalized groups? And if so, what was the origin of your definition? Thank you.
Yes, thank you, Gail. So we use the definitions based on our literature review that we comprised in year 1. And so that was based on BIPOC, so Black, Indigenous, and people of color, women, children, elderly, disabled individuals. We looked at, and I know I'm missing some groups, immigrants and the undocumented. We looked at over 300 pieces of articles, documents, government documents, books, to really kind of hone in this definition and how we were including different groups. We definitely had feedback on questions about our exclusion of the LGBTQ community within that space, but we really wanted to kind of look at those from and not saying that that group doesn't have a bit of being historically left out, But we wanted to look at kind of the policies that are directly impacting and harming these groups, and as well as the history that shows us the same as well.
Thank you.
Other questions from our audience? John, go ahead.
Hi, thank you, Cassandra. I have sort of a procedural question. Since a lot of this has to do with trust, I'm wondering how you evaluate responses from people in the community, especially if you haven't been there before and they don't know who you are. Is there any way to make sure you're getting information? And I'm kind of doing a riff on our political polling problems, which don't seem to match up with what people really think. So I'm wondering, how do you find out what people really think in your surveys?
Oh, you're asking a great question. So this year when we sent out, we felt pretty, it was a pilot, the survey that went out in year 2, with the 140 some groups and having 81 responses back. We had never had a conversation with these groups. I mean, I sent out I think a couple emails saying, hey, this is the project that we're doing. We know this kind of topic is important to you because you're doing this work. We would love for your feedback. We had a strong response out of really not having a good connection. This past year, when we sent out the 5,000 groups, typically, I believe research says that you'll have about a 1 to 3% response rate when you have no connection. And that was based on what we had. We had about a 2% response rate. With that, we also I personally received some, I call it love mail, from those that were in complete disagreement with the terms and the purpose of the survey. And at first, personally, I took it personally. Like, I just had a moment of, good gracious, like, I'm not.
That's right, yeah. Yeah, who are these people and why are they beating on me this way,
Right. But then I put on my research hat and said, this is fascinating. I would love to figure out a way to reach this group of people, because presumably it's not that those groups of individuals, it's not that the organizations that are actively doing the work are silent. There's a bit of trust that needs to be built, but it's a whole other piece of our population that doesn't even believe that equity is a thing, and that doesn't believe that we should separate groups and support groups differently. And so we're starting to have this conversation of how do we, obviously it's not my face sending out the survey. It's not me making the phone calls or sending out the emails. It's my co-PI and my colleague who's a white male who's doing that. And so we're trying to think of how do we reach other groups, the groups that are really upset about this topic, just to hear their stance and their perspective, to then kind of figure out how does one educate in that space. The hope is, if we're able to get continuation of funding, we want to do a content analysis that will allow us to, we have a ton of data. We have information from 5,000 organizations, over 5,000. I want to say it's closer to 5,800 organizations nationwide. We want to look at their websites and their social media, especially whenever an event happens, to see how these different groups are talking about the event. So that will allow us an interesting window in that space. But your question is right on point as we're trying to think of how do we reach those who are not excited about the words that we're so passionate about.
Yeah, thank you. I was, in the current cultural environment that we find ourselves, it does seem that if someone is asked a question using words that they object to, whatever you mean, their immediate response is either hostile or to hang up the phone or whatever. And so maybe this is an inappropriate question to ask you, but how is there a way to get beyond that? Is there a way to structure a survey so that you don't get that snap response of, well, you're people I like, so I'm going to, tell you everything I can, or you're people I don't like, and so I'm just going to cut off the conversation. Is there any procedure within sociology to sort of dismantle that snap response and actually get people's opinions?
Right. So I would start out kind of a similar process. I would identify, we'd probably go through the mail, our emails, to see some of those great kind of responses that we received. There were a few that demanded a phone call, and my colleague was so gracious and like spoke to them on the phone and said, after 30 minutes, we had a great conversation. So from a procedural process, I would, if I had extra money and extra time, I would absolutely create some focus groups of individuals that represented that perspective. And from those focus groups, begin to, have these conversations, like, how do you talk about this? And like, what are the trigger words? And what are some things that, essentially like creating a survey, I wonder how they would, and I don't mean to say they, but I wonder how those that disagree with such terms would kind of word a survey or talk to their peers. And from there, we would construct a survey that would then go out, right? And I think we would get a different type of response, which from my research perspective is absolutely valuable.
Sure.
Ultimately, the goal is to build relationships.
Well, thank you for continuing to do this, because I'm sure it must be pretty thankless when you are trying to get information and you run into stone walls, most of the time. So, and anyway, thank you for your answers.
Thank you.
Cassandra, before I open up for others, I did want to piggyback off of that question and the conversation that you had, because I definitely think that the way the design, how you design that engagement matters. And so you had referred to kind of have presenting on this project at our Equitable Coastal Resilience workshop. And what we had hoped with that workshop was very much, this was a virtual workshop that we hosted in November for 3 days, half days, but 3 days, that we were hoping to generate conversations across government, nonprofits, the private sector, and residents and community leaders on what are the challenges for advancing equitable resilience for coastal communities. And I think all great ideas recognized the execution of it in terms of those 3 half-days workshops were not something that would lend itself to participation by under-resourced community organizations or leaders, residents and community leaders who have full-time jobs that would then be trying to do some of this. So, really, I think spot on to this idea that how you design that engagement really matters. And I think that's something that, as our team was talking about this, and really, as I was kind of really thinking about how we could do this differently, was really to think about how you can make this type of work much more accessible to the people that you need to connect with. And, I think in that sense, we were kind of hamstrung because we needed to have it very substantive in terms of content, but then that by design excludes certain groups. So, but building off of that, I wanted to ask, one of the things coming out of that workshop was also that in a lot of instances, faculty members, researchers, we have great content training, we have great methodological training, but we're not necessarily trained in how to work with the community or how to do applied or engaged research. So since I do have some research colleagues here and I have some PhD students as well, do you have some general advice or general kind of insights that you could share in terms of those who might be thinking about doing something like this, a little hesitant, not sure where to start, or just have never even really thought about it much?
Absolutely. I have failed a number of times, which is our great learning lessons. I would say, so I am originally from Pittsburgh, Pennsylvania. I typically always wear black, as you see me with my black turtleneck on right now. And a lot of my work more recently has been going into rural communities that are in the southeastern region. And so I think sometimes, and I will just say myself, I think sometimes there might be a sense of, oh, I look like the people that I'm going to go speak to, therefore we should be fine. And that's false. Um, there, I would say my number one thing is going in with a lot of humility. That PhD education, that matters nothing. People, as some of the quotes that were in the PowerPoint, people just want to be treated as a human. They want their voices heard. They recognize that there is an injustice going on, whether they call it an injustice or not. They recognize that people like them are being harmed in an unfair way. Um, and sometimes they just want their voices heard. We had, on the flip side, in a study where it was an NSF's funded study that I led, we wanted to understand Hurricane Matthew and how educators are being impacted. And so we looked at, we were in 10 counties. We had something like over 4,000 responses from educators where we opened up the survey for just 1 week, which is shocking. And our perspective was that people just felt like they had been ignored for so long, and this was an opportunity for them to be heard. To be very frank and honest, to go back to what John was saying, we didn't use terms like marginalized populations. It was more of an event happened. How did this impact your life? And we had an overwhelming response from people who were to some extent unaware that we were even giving it. So I would say that really my number one thing is a bit of humility. Unless you are born and bred from that space you're going into, and even still, you know nothing about that community. You are not the expert in that space. You might be an expert in terms of you've published a lot, or you've been invited places, or you sit on all these committees or boards. Whenever traveling into communities, you are not that expert. They are. And to really position individuals and let them know that you deem them as experts. I've gotten a lot of invites back. I've had, the porch talks, the coffee talks, I've tried a lot of barbecue. I will say I've tried a lot of barbecue. People just want to be treated as people. And I feel like as academics, we can, especially when you do kind of the social science work, we might look at people as research, as findings, as an interesting, an intersection of different works, instead of looking at them as individuals who are being impacted by something awful.
Thank you. Bob has a question. Bob, I'll let you actually ask your question.
Sure. Thank you, Dr. Davis. This is wonderful work, and I look forward to diving deeper to understand. Just by way of background, I'm a PhD student, like Professor Youssef pointed out, but I have done just over 20 years of public safety career in the fire service, and about the last 6 of them as the fire chief of a community impacted by wildfire in Oregon, and watched all of this disproportionate impact firsthand. And I wasn't really sure how to frame this question, but I'm just curious, maybe your thoughts on the impact of, I guess just your thoughts on recency of an emergency impacting a community versus a community who is at risk or has high hazard, and if anything is sort of bared out in your experience in terms of community trust.
So recency. For whatever reason, so that's tying in with I had a great conversation with my class, a teacher's class called Natural Hazards and Inequalities. So fits right in. And we talk about the media and the portrayal of the recency of events, and how talking about these events can be the word that I'm just going to use. It's unfortunately, it's sexy. It's desirable to talk about how people are being harmed, especially if it just happened. Again, going back to Hurricane Matthew that hit 2016, we still have people that are living in hotels. In fact, a majority of those that have been kind of displaced are still in hotels, are still in FEMA trailers, are still not back into their home. But that's not a fun topic. No one wants to be sad about something like that, that event that happened. I can't do the math in my head, almost 7 years ago, 6.5 years ago. In fact, I went back to Princeville this November for Thanksgiving. My family were a bunch of nerds who wanted to go visit the town because that's what families who are nerdy do. And we came across the volunteer emergency firefighters. And we're looking at buildings that were still in disarray from Matthew. So like November, these buildings were still in disarray from Matthew that hit 6 years prior. What I can say is that those that Black, brown, white, if you are a low-income community and you've been hit by an event, that even research that's come out of Kate's and colleagues from 2006 study that looked at Hurricane Katrina in New Orleans, that found that essentially that these disasters that they accelerate pre-existing conditions. So if a place is doing really well, then a disaster will kind of propel that place into like an economic better situation. If that city or county or community is not doing well before the event, then an event happens, then the economy of that place will regress. And so we absolutely see that in North Carolina. We see that in Tennessee with the floods that happened a couple of years ago. I would imagine that we would also see that in the wildfires that are on the West Coast. We see them in tornadoes that hit in different places. So recency is it's interesting word to me. And in fact, I actually argue from my working grounded theory, I argue that recovery is not a thing for low-income communities, communities of color, that they don't get this opportunity when we're thinking about the disaster cycle, that they don't even get the opportunity to recover, that they're constantly responding since there is yet another event that is then impacting them, that does not even allow them to even consider what recovery looks like. So I'm really, it's twisted. From a research perspective, I am fascinated about timelines and recency versus long-term and the ways in which that widens inequalities. So even, and this will be my last thing because like I feel like I could talk about this forever, but even thinking about the families that are still in the hotels, people have died in their hotels waiting for homes that should have been built years ago. Thinking about families of 6 that are in a one-room hotel and their kids are still going to school. I mean, all the ways that impacts that people have dialysis, they're waiting, they're going through cancer treatments. All of these people still are living, but they're living in spaces that are not constructed for long term. And so what are the long-term health impacts that then impact those people? What are the economic ways that impacts? So I don't think I answered your question, but I am absolutely fascinated and interested in just the recency of events, and especially how we forget. We have a short-term memory. We forget about events and how they continue to impact low-income communities.
Agreed. Thank you.
I would like to thank Cassandra for joining us today and for her very thought-provoking presentation and the discussion. So thank you again for joining us, and thank you everyone for participating in the CCPO-ICAR seminar series today.